Hello, good afternoon. We are here as the Real Talk Show team. Obviously, you're seeing different faces today. We get to come with different faces each and every time. So, did you know that a number of young people avoid going to these health facilities, not just because the health services that are being provided are not available, or they are not just being given to young people, but because of the judgments they get from there, and just how they are misunderstood by the people they get to find there, or even sometimes they're even turned away. Do you get to know all those things, or maybe do you get to look at such cases in these scenarios?
And that, Margaret, raises a very important question. Does our community really support young people to access these health services, or does our communities intentionally hold them back?
Okay, so hello, and we are now just officially welcoming you to our Real Talk show here at TYP. This is a show where we get to have honest, bold, and impactful conversations that matter to us as young people and our communities as well. Well, you can see my name on the screen, but I'll still say it. My name is Margaret Selomani, and I am your host for today.
And my name is Mwene Brian. It's good to be back on the Real Talk Show. And you guys, it's good to have you here.
Exactly. And today's discussion is part of the Consent to Access campaign, which is supported by HIVOS through the regional SRH fund.
And under this project, we're also advocating for policies regarding the age of access or age of consent that allows young people to access these health services like HIV testing, family planning, or rather contraceptives, counseling, and accurate health information without any barriers.
Definitely nothing but accurate information for young people. And guess what? Today we are asking the question, which is how can our communities better support us as young people to access health services? How best is the community helping us? Obviously, you have seen a number of faces today, like the number is increasing bit by bit, and we have beautiful faces on the screen. And before we get into that, we're going to play something for you before we get to introduce who is on the screen today, the person that you're going to be talking to today, the persons that you're going to be asking questions to. We are going to play videos of us. We went into our community and we had to talk to young people and parents, and just hear what they know and what they say about a young person accessing services from these health facilities. So we're going to play those videos, and we'll be right back as we introduce our guests to start the discussion.
Great, Margaret.
Let me begin by this. Sex is something that's done a lot by young people. It's difficult to monitor and limit who has sex and at what age they have sex. But one thing we can do is try and prevent, these particular young people from having, infected by, different sexual reproductive health infections that come as a result of sex. So for me, I believe that the age of consent is to some extent a barrier to access to services, because a lot of people, nobody wants to go with a guardian, a parent at the hospital to go and access condoms and even access PrEP. It's something very difficult, something even impossible quite, because I remember there was a time when it was even difficult for us because of the facilities approach towards youth access to sexual reproductive health. But now, since we are getting there in terms of young people accessing services, the challenge now is the age at which young people are having sex is getting even younger. We're having 13, 14, 11-year-olds having sex, and they are the contributors, to the surge in STIs, HIV, and other infections that comes as a result of sex. So I feel it's important that we allow young people that want to have sex to access services when and as where they would love to access them. So that's my 2 cents.
Manyereti awabirizi abana mawoto family planning. Then chintu chichitika chakuti mwana amutora ku hospital wakumuyasa metu ndizora 14 years. Then after that chichitika mwana amutora kwe wakumuyasa nyereti again warare open kuhindi honse mbwa musanko wamuyanda kwamana kuzumina mbwa musanko wamuyanda kwamana kuzumina kambo tikutuliche ni uliyasudwe nyereti wabo open kuhindi honse mbwa musanko wamuyanda wazumina ponya mbomu matombora mzi imarwazi. And then alimi chichitika chakuti ibu wotu kwabira bana manyereti imbu botu kambo bana baratugwashana ma days ura 14 years mwana wa mita. So nyabona muyasa bana ma family planning nomupa muhibadera mwelede kuti imwana wamuyasa manyeti wabora mwana mushonto ndura 15 years maybe ura 14 years. Nyomwede kuti mwana mamuta advertise ngombeti mboya so manyeti aya toyede kuti kambo wayaswarya wede kuti kwabira kwenda munkwera kamboti monya momuyaswa moya murabora marwazi ainde nende syphilis HIV urakuhakwiti nakamboti liyaswide then warivura bo kwabira kamboti wayaswa tokohigumita. So nywebo nomuyasa bana mweze kuti nachindi chakuti maybe bana babora bali 4 mwababika wose paita ambali mwabaisha mo bakuti basambo tomuyasa kwa family planning tamwere de kuba open kwindi hose kuti bamari mbwa mwari ngoyanda wenda waro waswana na waro kuberesa makondo mwanso waswanyereti waheba kutakamba kuti ndira kuhagumita wede kuyaswanyeti kambo wayaswamanyeti wede kuli kwabirira kweza makondo makuti waya wona musankwa wabikako kondo mutawa kuti utacheni utawezi koburwazi kambo wanso wona bwo ati kambo ndiri kwabiridwe ndiri asude nyeti siko higumita urakuhagubweza iburwazi kochiri mushonto. And then urajanako kuchita pretend kuti ura 15 years wachiswa koburwazi. So muintu wonse zokuri kwabirira toya kwabirira pakuti kambo wayaswanyereti wede kuri kwabira muintu wonse kuti mboya yaswanyereti tari kwabirira kuti utabi pregnancy so wede kuri kwabira muintu wonse once waswangana musanko abona ngoyo wede kuweza condom kuti utanzi utabwezi bulwazi again weze kuri kwabira muintu wonse once utabmiti utabwezi bulwazi.
Great. Brian, you can go ahead. Okay, so those were the views from the community, like people we had from the community. And I mentioned to say just after that video, we are now going to introduce the faces you're seeing on the screen today. Brian, you can go ahead.
Great. Thank you so much, Margaret, for giving me that opportunity to welcome our guests on the show. The gentleman on this show, the sign language interpreter, some of you guys know him already. He is Shadrach Chansa. He's a sign language interpreter. You know, you guys, that us at the Youth Platform 360, we believe in inclusion, that no one is supposed to be left behind. Henceforth, our sign language interpreter. And to the two ladies, one, I have Grace Mapenzi Chimbozu from Windows and Psychosocial Zambia, a trainer of psychosocial counselors. Welcome, Grace. Welcome on the show.
Okay,
thank you very much for welcome.
Thank you. Thank you. We also have Meliana Kasuza. She's the project officer from Chipembere Community Development Organization in Malawi. So today we are going to Malawi. Those who are in Zambia, we are traveling to Malawi today. We are going to hear and just learn more on how they are doing it in Malawi. You are welcome, Meliana.
Thank you so much. I'm very grateful to be part of this, to feature in this Real Talk. Thank you so much. Thank you. I'm Meliana from CCDO. Yeah.
You're welcome, Mariana, on the show. And it's important to have you here so that we also have that context from the other side of the southern region, which is Malawi. In as much as our problems may be similar, we also differ, or sometimes we are the same in how we handle these problems and how we solve them. And it's important to have you so that we also have that context from Malawi. Thank you and welcome on the show.
Thank you so much.
Okay, so not forgetting that we are not just alone on this screen, like the people you're seeing on the screen are the only ones on the show. Even those who are watching on our Facebook page and our YouTube channel, you're also part of this show. Don't feel left out. This show is for everybody. So if you have comments, you have questions, where you're watching us from, you can just let us know in the comment section and let this conversation keep going, and let's conversate in that way. So looking at our
Exactly.
topic of discussion today, which is how can our communities best support young people to access health services, we decided to bring in Madam Grace, who's going to give us a perspective of how the community really actually sees this issue and how best the community can help at the end of the day. And of course, Meliana is going to give us another perspective of how her community in Malawi is just handling cases of how young people can actually just be able to access services that are provided for them. So we are getting right into our discussion of today. And my first question is going to Madam Grace. So I'm going to start with you, and I would like you to just help us know how the community, or how does the community shape the way young people think about health services. Madam Grace, over to you.
Thank you very much for the question that you have asked me. Indeed, this is a very, very important topic that we are discussing this afternoon. And, when you ask the question, how does the community shape the way young people think about seeking health services, it starts with an informed mindset of the member of the community, a parent, for example. Because of our culture, in our culture, there are things that parents find it very, very difficult to discuss with their own children. For instance, when you want to talk about sex, a child comes to the mother or the father to find out about issues to do with sex. The first thing this mother or father will think about is, this is taboo. You can't discuss issues to do with sex with me. Who brought you up? And we are forgetting that where we are, the era that we have reached, things have changed. Even if we don't provide answers to our children, they are able to find their answers from Uncle Google. Uncle Google is able to provide those answers to them. So we are trying to, as members of the community, what we are actually doing to our children is we are hiding information from our children, thinking we are protecting them, but instead we are actually putting our children at a risk. Thank you very much.
Great.
And you mentioned how young people need to be supported in these when it comes to accessing health services, and how parents play a critical role when it comes to young people accessing health services. So I would also love to find out what are some of those experiences that either encourage you or discourage you when it comes to young people going to these health facility to access sexual reproductive health services, or just any other health services.
For me, I would say I'm at an advantage because of the type of job that I'm doing. I'm a psychosocial counselor. And as a counselor, one of the things we do is we provide information to people. It does not matter whether the person who has come is young or the person who has come is old, but I just feel it is important for members of the community to also have this mindset of being able to share information with our children. I was listening to one of the clips that you played. There is a mother. That mother was talking about the healthcare providers providing information to the girls as they go to get family planning. But I thought it is better, the mother should be the first person to provide this information. The mother is the primary caregiver. And when a child gets information from a parent, they take it as gospel truth, and for them it is all about love. Oh, my mother is able to talk to me about all this, meaning my mother really loves me. But we want to show off everything to a healthcare provider. We want the healthcare provider to be the only person to provide this information to our children. For me, this is not right. Thank you very much.
Great.
Thank you so much, Grace, for that insight. Indeed, parents do play that critical role. And Margaret, you hear from the videos, there was a mother talking about how young people are supposed to be allowed to access these services, and how parents have the responsibility to support young people when it comes to accessing their health services. And I think, to me, that's a very good take. And to everyone that is watching us, it is very important that you could be a parent to support your young people to access these health services. What do you think, Margaret?
Yeah, exactly. When I had a look at that video, and the moment I heard the part where she said, healthcare providers should provide information to young people, and especially when they get to go there to access certain services. Yes, quite all right. The healthcare provider should be able to at least advise and just give certain information to young people before they can actually just receive these services, because sometimes as young people we do access services without really knowing how these services will either help us or affect us at the end of the day. But then we are not just coming from somewhere and we get to find ourselves at the health facility. Obviously, we are coming from homes. And this is where I feel like parents should have, just like Madam Grace has mentioned, parents should have that relationship with us as young people, as their children, in the sense that if I have any issue that is kind of pressurizing me or giving me that that kind of thinking, I should be able to go to my parents, I should be able to go to my mom and explain to her, this is what is happening. Maybe I'm sexually active. This is what is happening. And at the end of the day, my parent will be able to just advise me and tell me what I'm supposed to do. I don't have to run to the health facility for me to get certain information when my mother has the information that I want at the end of the day. So even to us as young people who are watching this, if you have your mom close to you, or you have a parent, your guardian, whoever you are with, they are close to you, please drag them and bring them here so that they can listen to this show and we can get to learn at the same time. So thank you so much for the response that you've given us, Madam Grace. So I'm going to go to Malawi now. We are moving from Zambia to Malawi. I hope you have your passports. Melian, I'm now moving to you. So from your experience, how do communities in Malawi influence young people's access to health services?
Here in Malawi, the community is playing a very big role in helping these young people to access health services through promoting access. On this part, the community is engaging young people in providing information to young people concerning their SIHR, so that they should know where to, how to get the SIHR information. And also, there's this educating, we are educating, the community is educating young people through awareness campaign in their communities. They are having some camps whereby they tell their young people about the challenges or the effects of SRHR. Yeah.
Great.
I think that is quite good. It's really encouraging what the community in Malawi is doing, encouraging young people to obviously that leads to young people accessing health services. But from that which you have been doing, and from the response from the community as well as the young people themselves, what are some of the challenges that you have faced when it comes to young people accessing these health services, transforming from not just talking about them, but also when it comes to accessing the actual health services?
Yeah. Here in Malawi, three major challenges which we have been facing. The first one is stigma and judgmental. These health facility workers, they are judgmental to these young people in terms when they want to have this access to information about their health. So, and the second one is distance. There's a lot of hospitals in communities are far from communities. So these young people, they fail to access this information because of long distance. As I said, they get wrong information about their health. This result to early marriages and safe abortion. So these are the challenges. And the last one is lack of youth-friendly services in hospitals. These young people, they need to have a space whereby they can be freely access this information to these health facilities. But you see, in a lot of our hospitals, there are no youth-friendly health services whereby these young people can access information about their health. So this has been a major challenge so far here in Malawi. Yeah, that's what
Thank
I
you
can
so much,
say.
Marianne, for those challenges that you've mentioned. And I think in my preamble, I mentioned about us in Africa facing quite similar problems. The issues you mentioned of stigma, the issues of distance, the issues of lack of youth-friendly health services, the health workers, those are quite some of the problems or the challenges that even us in Zambia, we have been experiencing. And I think from the interventions that we've been doing, and now we're advocating for young people to access these health services regardless of their age, I think we'll get there soon. If as long as we continue putting in the work, I think, Marianne, you can attest with me, you can agree with me that we'll soon get there.
Yes, yes. We'll soon be get there. Yeah.
Exactly.
Definitely. That's I feel like we're in Malawi, but we're still in Zambia because we're kind of looking at the same issues that we face, like issues to do with health care providers being judgmental. Obviously, at the moment in Zambia, I would say youth-friendly spaces are there, and they are at least they are operating, and young people are able to access these health facilities through the youth-friendly spaces. So, Melian, you mentioned to say you have lack of youth-friendly spaces, and obviously, if you have lack of youth-friendly spaces, you're going to find that a number of young people are vulnerable in this case. So, you as Chipembere organization, community development organization, so what does that look like on the ground, especially when it comes to girls and these other vulnerable groups that you have in Malawi, especially when it comes to accessing these services? How does that look like?
So, if I can say, I can take Chipembere as a whole. We are doing a lot of initiatives to help in combating these problems. The first one is we are training youth to make them to be peer educators so that they can be advocating for SRHR in their communities. These peer educators are acting as the role models in their communities. We train them, we tell them more about SRHR, how to get the access to information about SRHR. We have an awareness campaign whereby we are conducting this awareness campaign in hard to reach areas whereby these young people are failing to access the information about health services, about their health. So we are having these awareness campaigns. We are doing trainings to young people so that they may be trainers of trainees to their communities to help amplifying the voice of the young people in the communities about their SRHR. So that's what we do as Chipembere. We are helping the government to amplify the voices of these young people about their SRHR through awareness campaign, peer-to-peer. Yeah, and also we are engaging leaders, community leaders in each and every initiative we should do. We are engaging community leaders about this problem so that they should be acting as, because they are already There are key factors of these problems which these young people are facing in the communities. So we engage the community leaders to help us in advocating for this SIHR. Yeah.
Great. That's really important and amazing, especially the fact that you are engaging these community leaders, because when community leaders speak in the community, people will be able to just obey what they say, and you
Yes.
just bringing in this initiative of just bringing them in. I think it's a good idea. So without really forgetting that we also have the online community, they are also commenting on our Facebook page. We are here to read your comments. If you have anything that you'd like to share, you can tell us. We have Racine watching from Solwezi. Thank you so much for joining us, Racine. And watching from Kawe, Karen. Thank you so much, Karen, for joining us today. If you have any questions, you are following us, you are following the conversation, you have any contribution, you can just let us know so that we may be able to read your comment. We also have Caristo is following. And I also have a comment from Racine. Racine is saying some children are afraid of approaching their parents because of the relationship. Some parents don't tolerate that. That's very true. I have seen some of these things happening where children are just not able to speak to their parents because they don't have that relationship between the two of them. Thank you so much, Racine, for these comments that you've just given us. We also have Faith Malamba watching from, okay. Faith Malambo is watching from China. Okay, thank you for joining us from China, Faith. Thank you so much. So I have a question for Madam Grace. Basin is just from commenting to say we have parents who do not really have that relationship with their children when it comes to like just having conversations on this. So my question is, what role do parents, guardians, and the community at large, or even the community leaders, play in increasing safe space for young people, or for creating a safe space for young people? What role should they take? Madam Grace.
Thank you very much for that question. Parents play a very bigger role in creating awareness to their children when it comes to issues relating to STIs and sexual reproductive health. When a child is able to get the information from the parents, when the community leaders are able to come up with policies that are able to help out, then it becomes easy for us to have a community that is healthy, a community that is free from different kinds of illnesses. Now the challenge is because of our culture. I want to talk about our culture where, in our culture, it is a taboo for a father to sit down with a girl child and start talking about sex information. It is unheard of. But I think we need a change of mindset, because whether we bury our heads in the sand, we know our children are engaging in sex. The examples are there. The evidence is there. Go out there, go to the facilities. You'll find young girls as young as 12, as young as 8, they are pregnant. Some have STIs. I remember when I was doing my attachments somewhere, I will not mention where, young girls, one was 8, the other one was 10. The parents brought them and they said these girls were raped. But for them, they were not actually raped. They believed they were actually in a relationship with this man. And so some people actually took this matter, So these are some of the things that we need to, information should start from home. Once information starts from home, as they say, charity begins at home. It will be easy for these children to be built up, mentally, psychologically. They have this information and they'll be able to make an informed decision. Thank you.
Great. Great. That's really important and something that our parents. I say it to our community, to our online community, that if you're listening to this show and you're with the parents, please drag them. Let them come here, sit here, and listen to this show, because this show is not just for you as a young person, but it's also there for your parents to be able to learn one or two things. Yes, quite all right. We have a norm in Zambia where parents, like your father, cannot sit you down as a girl child to talk to you about sexual matters, but your mother is the one who's supposed to do that. But what if your mother is also lacking information in those ways? How can you be helped? Madam Grace has mentioned a number of things. I'm going to give a chance to Brian to say something. Brian.
Thank you so much, Margaret. And I think Madam Grace have mentioned quite a number of things. And my key point is how parents are supposed to be engaging their young people. And I think she mentioned of charity being charity starting at home. And I think that is very important when a child, or rather a young person, hears the information from the parents. To them, that is gospel truth. And imagine if we have parents that educate these young people about these sexual reproductive health issues, where they are telling their young people, this is what you do when you have sex, this is what you're supposed to do. I think would even reduce these numbers of teenage pregnancies, HIV, new infections amongst young people. These numbers would go down, because then the parents are also part of this campaign. And also that brings me to a question to Madam Grace, where if you heard what Marianne was explaining about how Malawi is doing it, where Malawi is actually encouraging these parents, these young people to work together. And when it comes to a context of here in Zambia, how can parents, together with young people in the community, work together in order to bridge the gap between young people accessing these health services and also young people refusing to access these health services simply because they are denied by their parents?
Thank you very much for that wonderful question, Brian. It starts with information. You know, parents, when a parent is informed, a parent knows, a parent has this understanding of the importance of this child being able to access, you know, reproductive health information from the facility or anywhere. They will be able to, you know, interact with their children. They will be able to relate. They will be able to speak to their children about the importance of these things. Let's say, for example, you know, if a child starts asking about issues to do with sex, already that is this child informing you that they are either engaging or they have plans of doing it. They already, you know, when a child has reached puberty, a child who is between 10 to 24, their body starts performing in a certain way. They start feeling sexy. And because they are feeling somehow in their bodies, they want to practice, you know. And when they are, you know, interacting with their friends will tell them, no, me, I did it. It is nice. And because it is nice, she also wants to feel the nice thing the friend felt. But if now this child has a parent who is able to tell them, yes, it is normal to feel this way, but you are not going to participate. You are not going to do it now. Wait for the right time. The reason I'm saying this to you, it's because one, if you engage it now, one, you do not have the proper information. You don't have the proper knowledge. You be infected with HIV. You have some STIs. You talk about cervical cancer. You talk about unwanted pregnancies. You know, once a child has this kind of information from the parents, you know, also from the community, it becomes very easy, you know, for this child to understand, because my parents have said it, I will follow what they are saying. Thank you very much, Brian.
Great. That's very, very insightful and very important. I feel like Brian mentions to say we take whatever we get from our parents as gospel truth. So if our parents are able to just discuss these things with us. And like Madam Grace has mentioned, to say, if I get to find myself in a situation like I'm going to ask my parent about something that has to do with sexual reproductive health, you as a parent or a guardian there, you must, it must click in you to say, okay, I think this is the time that this young person needs information like this in order for them to protect themselves at the end of the day. Because us as young people, we get to get information from our fellow friends. If our parents are not giving us the information that we need at the end of the day, we'll definitely get it from our friends. And at the end of the day, we're going to get wrong information from our friends. Brian, was that okay? The answer that she gave you, was it okay? Are you satisfied?
Yes, Margaret. She did mention about quite a number of things that I think I agree. Young people, parents, the community, all together, we have a role to play. They say it takes a community to raise a child. Where you cannot give this information as a mother, as a father, at least refer to a member of the community. It could be a neighbor who has this information. It could be, we have neighbors that are doctors, we have neighbors that are nurses. It is important that when you don't have the right information, you refer the young people to those members of the community that may have the right information. Because I mean, information is another thing, and misinformation is also another thing. So whilst we are trying to give the information, it is also important that we give the right information to the young people. So again, Margaret, I say to those parents that feel they do not have the right information, it's important to always refer to the people that have the right information. What do you think about that, Margaret?
Yeah, that's really important, and that's something that should be put into consideration. It's not just about young people, but it's also about the parents and the homes where they're coming from. And this is going to help us at the end of the day if we work together as young people and parents at the end of the day. Melian mentioned something to say. Their community in Malawi is kind of on a different level when we compare it to Zambia, where their community is fully involved in just ensuring that there are awareness sessions there where young people are being taught on how exactly they can be helped in terms of their sexual reproductive health. And we also have a number of things that you mentioned. So before we go, we dive into that. We have some comments on Facebook page where young people are asking questions. Brian, you can go ahead and just read that for us.
Karen M. Lungu says, do you think engaging faith-based leaders can help in disseminating SRH information, considering their stand in the community? This is a brilliant question from Karen. I think this is important because, I mean, when you look at how young people, how they spend their time, you often find that it's either they're at home, they're at church, or school. And I think this is quite a very good question. And I would love to throw it to, first, I would love to throw it to Madam Grace. What do you say about engaging these faith-based leaders or organizations at church, for example?
Thank you very much for that question. Indeed, it is a very, very important and wonderful question. For me, I believe it is important to engage our faith-based leaders. One of the things I do, I serve in church. And one of the things I do time and again, I talk to young people about issues to do with sex. You know, most of the people believe simply because someone goes to church, they are all Christians, they are all holy. Just because a car, you know, you are in a garage, it does not make you a car. So in the same way, simply because someone is in church, it does not make them holy. And this is why when you look at most of the young people, you find 3/4 of them are pregnant, 3/4 of them are they are engaging in so many things. They have so many different conditions. And this is why it is important for faith-based leaders to find time and also to create safe spaces for these young people where they can now sit down with them and talk about real life issues. This is real life. It's no longer just a story, but these are the things that are happening. They are happening right in church. Some of the church leaders, they are church leaders quite all right, but you would find this young girl will come to you and say, Minister so and so, Reverend so and so, Pastor so and so did this to me. I went for prayers, and as he was praying for me, he was touching me in these areas, and I felt somehow. So they also need the information so that they will be able to share this information with their members of the church. Thank you.
Thank you so much for that response. And to the young person that sent the information, the question, thank you so much, Karen. That was really a brilliant question. And I think she has answered it well, where she's saying, indeed, we need to engage these health-based, rather faith-based leaders when it comes to giving the right information to the young people. And I think that is also a way that we can reduce the lack of information or the missing information in our young people in our communities.
Great. That was a very, very important and yet interesting question that just came. And thank you so much for asking that question, because it has kind of also made us to look at these issues on the other side. Like, most of us, we get to think the church is a holy place, so you can't talk about sex in church, and they're not going to allow you to talk about anything that has to do with sex in church. But then we need to understand that young people are also found in churches. We have young people everywhere. We have young people in the community, in the churches, in schools. Everywhere young people are there. And so when certain things are happening like this, you just have to find ways in which you're going to at least talk to them at the end of the day, in as much as it is a holy place. We need to have such conversations. Melian, do you have any response towards that, or you are okay with that? Melian, are you still with us? Okay, it seems like network is lagging on Melian's side. And, the Root Talk Show, I feel like the Root Talk Show gets to have little time.
Hello.
Hello, Melian. We can hear you. Are you still there with us?
Yes, I'm here.
Okay, so as we are winding up, my question would be would go to Melian on you mentioned to say, as Malawi, you have a number of people in the community who are just being there and they are helping at least to bridge the gap in terms of the giving information to young people on how exactly they can work together in terms of just giving information on sexual reproductive health. So now, Melian, how important is it to have young people and the community involved to ensure that this problem of maybe lack of information is curbed? How best can that be worked on?
These young people needs to get involved in activities which are happening in communities concerning their health, because when these young people are getting involved in activities like that, it helps them to reduce stigma. It helps them to have this sense of responsibility on their own, and also it promotes togetherness about each and every activity which is happening. Because when these young people are left behind, it's like we are left the whole nation, because they say we are the leaders. They say we are leaders of tomorrow, but it's not leaders of tomorrow. We are the leaders now. So the leaders are us young people. So young people needs to be engaged in a lot of activities which are happening in communities, so that they should get to know that they have that sense of responsibility. Yeah.
Great. Thank you so much. Brian, you can go ahead.
No, I just wanted to mention that she did raise a very good point where she mentioned that it's not that the youth are the leaders of tomorrow, but they are the leaders of today. And what does it mean to
Yes.
be a leader? It means you take charge, and that is inclusive of your health. And that brings me to the last question as we are winding up to the both of you, Marianne and Madam Grace. So I'll start with Madam Grace. The community, Madam Grace, is watching. And what advice would you give to the people, or rather to these communities or the young people, with regards to young people or supporting young people to accessing health services?
Thank you very much, Brian. The last word I can also say to the community, and as well as to the youths of who belong to the community. Let us not hide information from the youths. Marianne has rightly said, the youths are the leaders of today. We have an adage in our Zambian culture where we say, imitikula empanga. You know, these shrubs of today are the forests of tomorrow. So indeed, if we don't prepare our youths today, how are they going to lead tomorrow? Let us provide them with information so that as they grow up, they will be able to share this same information that will be given to them with the children, the youths of tomorrow. Thank you very much.
Thank you so much. Thank you so much, Madam Grace. And I would also love to hear from you, Marianne. What are the last words that you have to the community that is watching you right now?
Thank you so much, Brian. My last words to the community which are watching us right now is that they should involve these young people in a lot of activities which are happening in communities. These young people needs to be busy with things to be done in communities, so that they may reduce the risk of getting into some bad activities whereby they can contact HIVs, they can have these early pregnancies. So when they are involved in activities which are happening in the communities, this will help these young people to have that sense of responsibility which I've said, and also it will help their mental health. They will know that we are being recognized in the community. We are the leaders. Indeed, it's not on the books that we are the leaders, but when the community is involving them in activities which they are doing, these young people will feel recognized. They will feel they will have this sense of ownership in all activities which are happening, as is that their health will be protected. So that's what I can say. Thank you.
Thank you so much. And Margaret, is there anything else that you would love to say? It could be to our guests, to me, to our sign language interpreter, and most importantly, to our viewers out there.
Okay, thank you so much, Brian. Looking at time, we're running out of time, and I get so sad when the information and the conversation is hitting. That's when the time gets to move so fast. But then there's nothing we can do. We just have to go. I just want to say thank you so much to our guests that we have, Madam Grace and Melian. We thank you so much for the information that you've given us today. It has highlighted some of the things that we are going through both in Zambia and in Malawi. And of course, we had the chance to just travel to Malawi today. Even though we don't have passports, we were able to travel there. And I would like to say thank you to Shadrach, who has been fighting with the air. We don't know what he's doing, but he has been fighting with the air. We thank you so much, Shadrach, even though we haven't heard your voice, but your presence here has really made it possible for our friends out there who are unable to hear us to just be able to be part of this conversation. And of course, I would like to say thank you to Brian for joining us today as our co-host. You have been an amazing co-host, and hoping that we are going to be doing this more often together. And of course, to our online community, you have been so amazing. You have joined us from China, from Kasama, from Kawe. We love you so much, and we love the comments that you share with us. And stay tuned even as we bring more information and as we come with more interesting topics for you. From me, it's a bye-bye. Thank you so much.
Bye-bye.
Thank you.
Thank you so much.
Bye-bye.
Bye-bye.
Thank you.